Hey everybody, you're now listening to Cup of Queens with Paige and Saray, and today we are talking with Dr. Sue herself from Catalyst Medical Center and Clinical Spa. Sue is so full of wisdom, encouragement, and her passion for supporting others truly shines through. Sue talks with us about injectable treatments like Botox and filler, how to prevent aging, medical procedures she has performed, and the incredible transformations she has seen within her clients. Sue truly cares about the overall impact there is to be made on her clients by making them feel beautiful in their own skin. So grab your cup and enjoy! Thank you so much, Dr. Sue, for coming on our podcast. So we have Dr. Susan Matheson, who is the owner and founder of Catalyst here in Fargo, and Saray and I both love this industry. And so we're so excited to visit with you and learn everything about your business, how you started. So give us all the info.
Ooh, golly, it was 21 years ago. And so I was kind of the pioneer in the area. I kind of call myself the Melissa McCarthy of plastic surgery. It's maybe an unexpected person, but I love making people feel good about themselves. Mm-hmm. And we all know the power of a bad hair day to kind of make us feel like we want to live under a rock.
Totally. We've been there.
So,
So I'm fixing my hair right now.
Yes. But it's like looks aren't everything, but I think we all want to feel like we present ourselves in the best way. So, I'm a physician. I had decided in high school that I was going to be a doctor. My dad was a doctor. My mom was a nurse. I'm the oldest of 7, so I began caring for others when I was like 3. I was a candy striper and at Old Dakota Hospital, so it goes a long way back. I went through college in California and medical school in Texas and residency in Seattle, Washington. I think I found the perfect specialty because I take care of little tiny babies in the intensive care unit for things like tongue tie or congenital anomalies like missing ears, that kind of thing, all the way to the elderly, people 100 plus or people in hospice. And I get to have the empowerment and the fun of the beauty industry, but I also take care of patients with cancer. So, I just have such a breadth of, helping people, and I'm so passionate about what I do. So mm-hmm. I just love my work, and I was with a big multi-specialty clinic in town, and great doctors, lots of great, it's like I still have privileges at both Sanford and Essentia, so I do surgery at both places, but I kind of was a little, entrepreneurial, and I wanted to explore, a private practice and bring on some extra services that were, 21 years ago, pretty new. I worked at a clinic, but I bought my own microdermabrasion machine and started doing some treatments on staff and some children of staff with acne and things. And so I kind of got started that way. And then when I kind of took the leap and started my own practice, that was a integral part of what I did. And so and then suddenly others noticed, the Allergan folks who are the makers of Botox they're like, hey, this little clinic in Fargo, she's doing something right. And so, I've had the vice president of Allergan, come, he actually was like, he went to our farm and he toured Catalyst when it was just, the new building when it was just in studs. And so wow. I kept in touch with him over the years. And so, it's basically a multi-specialty clinic. We have the beauty of aesthetics and, the science and the helpfulness of our medical side too. So mm-hmm. It's really a lot of fun. So
that is incredible that you can cover
all of those bases. I mean, that's such a wide range of things that you do, and it's really cool that you're able to be an expert in all those different areas.
Yeah, well, it's like it might not seem like they tie together, but they really do. And I've always kind of approached my world from a kind of a holistic perspective, because it's like, on the medical side, I would say that, I have I'm actually boarded in integrative medicine too. But, it's like you can't just look at, one system in isolation. It's like our immunology affects our gut and vice versa. And, I get to work on the inside and the outside of ears. So I have to, worry about the fact that, cartilage in little babies, is super soft, and so I can mold their ears and maybe even save them from, otoplasty, because of, as the estrogen decreases from their moms, their ears kind of stiffen. But if I can get them early on, I can make their ears look better. But then I also get to deal with the inside of the ears and help them hear better. And so, it's kind of like, I focus mostly from the shoulders up, but yeah, it all kind of interrelates. And, sleep, when you sleep better, your skin looks better. And, as I said, it sometimes doesn't always make sense, but in my mind, it's like, each patient is a little discovery. It's like, okay, maybe you came in for this, but then we get talking. Sometimes they're in behind because we get talking, and we find other ways that it's like, I think this is affecting this, and if we did this, maybe you'd feel a lot better. Botox was actually, discovered for a medical reason. People who had, really bad spasms of their muscles of their face, and sometimes even so that their eyes would close, and that's called blepharospasms. So they couldn't really see because they kept blinking their eyes so much. Well, those patients were like, "Hey, doc, it's like, this looks good.
Let's keep this rolling.
Where else can I put it?" Yeah, exactly. And so, from that, it was actually in the late 1990s, and I trained in Seattle, and that's just south of Vancouver, Canada. And the main it was a husband and wife team actually. She was an ophthalmologist, and he was a dermatologist, and she did some oculoplastics too. And so they started hearing about Botox and started using it, and then they're like, hey, if we use Botox before we do lasers, the skin is smoother, it heals better. And so I kind of got to learn from the grandmother and grandfather of the Botox industry.
Wow.
And and then as we used it cosmetically, we realized, hey, or the patients told us, hey, it's like my migraines are so much better. And so, now it has an FDA indication for migraines. And so, as I said, things really do blend together when you kind of take this wide picture approach. So
yeah, that is wild.
Yeah.
And think of how many lives you're able to impact and touch. I just think that's so cool. I think it's really great.
Oh, yeah. Well, thank you. Well, I think we all have that opportunity. It's like, I think if you approach each day as like, how can I serve and how can I do something kind? So we all have that opportunity. So, it's like, I feel blessed to be a doctor, but as I said, we can all have that power to really, help people. So,
yeah. And I think that stems from what you kind of touched on earlier, but just having that confidence. It is true. Having a bad hair day can really domino effect into other things.
Yeah.
And so because you do focus on kind of from the shoulders up, and I think a lot of our listeners have interest in skincare and just how to age gracefully and feel their best, absolute best. So what are some things that you guys practice within Catalyst to kind of, set yourself up for the best possible kind of aging process?
Yeah.
What are some different things?
That's a great question. I think it all starts with basics. And, it's like hydration. I'm not a perfect example, but it's like, eating as well as you can. We know that, a diet rich in fruits and vegetables and good fats, like avocado and olive oil. And there's so many ways, that we can, maintain good health and better aging with just the basics. And then from there, we always say that sunscreen is the best anti-aging potion that we have. And so it's interesting. There's some controversy about sunscreen, and I don't really understand why, but I do think we need some natural sunlight, but not to the point of burning. So it's like you can get vitamin D, in a 15-minute exposure, ideally in the morning, because that really supercharges your kind of biochemistry in your brain and body. But especially on your face and your hands and your neck, even in the winter, we get a lot of UV radiation through, the window glass, and of course in our cars. Almost all of us who do a lot of driving end up with some pretty impressive changes on the left side of our face.
That's bad news for us,
I can't
Paige.
even imagine that. Yeah, we're in our cars every day. We're in sales, and so it's like, ooh, when you think about it like that.
But it's like you can get like UV window film.
Really?
Yeah, so that could be helpful. But there's a few years ago, I wrote for the forum for many years, and so one of my articles was I used a picture that was published in the New England Journal of Medicine, one of the most prestigious journals, and it had a picture of this gentleman who was a truck driver for 40 years, and it was just like the left side of his face was just completely different. It was it was really saggy, very deep wrinkles. It's almost like not only did it the UV damage impact his skin, but almost like the fat and the structures underneath. It was just really, really different. So it's like almost like a different person from one side to the other. So
So you mentioned a little bit about some controversy around sunscreen, and I haven't heard that, to be honest. Can you talk to us a little bit about what that is?
And I think there's I was just talking to my dermatology nurse practitioner today, and some people have concerns about benzene and certain ingredients, but that there's benzene in sunscreen. Well, there's benzene in a lot of things, and like if you fill up your car with gas, you're going to get more benzene in that 5-minute exposure than you would ever get with probably a month's worth of sunscreen. So I do prefer like the mineral based sunscreens that have like zinc oxide and titanium in them. Okay. Because I like the concept of kind of like reflecting it back. And also it's immediate. With the other, the more chemical sunscreens, you're supposed to wait 30 minutes to kind of like.
Oh my gosh.
Yeah.
I had no idea.
So yeah. And, when zinc and titanium sunscreens were first developed, they were, maybe not as cosmetically elegant. You kind of looked like you were, slicked yourself with Desitin, butt ointment, but but now, they're really sheer. A lot of them have a nice little tint, and so they're really lovely, and you can, I wear a tinted moisturizer with sunscreen every day. So a little tiny bit of coverage, and just that little bit of nice protection too. So
Yes. I've never heard that in my entire life, the 30-minute thing, and I'm stressed.
Well, I've heard about like you have to wait before you go in
The water?
I didn't know about your face. So now I'm curious. You've probably heard of the brand Supergoop, right?
Yep.
Is that a good sunscreen brand for your face?
Yeah, yes. I think that has zinc and titanium in
Okay.
it. So, yeah, I'm pretty sure. So,
Okay, because now I've been really using that
that's a good
consistently.
one.
So,
Yeah.
okay.
I want to touch on the zinc and titanium because those are two ingredients. I have super acne prone skin.
Yeah.
And those are two ingredients I have always heard to kind of stay away from. And I have kind of seen that anytime I use sunscreens with those ingredients.
Interesting. Yeah.
I feel like I break out a little bit more.
Interesting.
Is that did I make this up or is this a thing?
I have not heard that, but I can look into it for you. Yeah. And I wonder if it isn't something in the like the carrier vehicle, some of the, oils that they use to emulsify or something, but I haven't heard of them being comedogenic, but I'll check it out for you because, it's like, I don't know everything, but I know how to find out almost everything.
Well, and the thing, I think we've talked about this on another episode, is you can find anything to prove anything. And so it's like
totally.
the one time you hear someone say this particular ingredient causes breakouts, like that's what sticks with you. And it's who knows who came up with it. But speaking of that, I mean, that is something that I think would be very interesting to hear about. I think there's a lot of people who suffer from acne, and it seems like kind of anti-aging and acne treatments kind of can go hand in hand sometimes. So what are some things that you do to treat those particular issues, skin issues?
And, and acne there's baby acne that's related to hormones, from mom. And then, of course, we all know about teenage acne. And then, there's middle-age acne. And sometimes there's even elderly acne. But, acne is a complicated kind of multifactorial inflammatory disease. And basically, the pores get blocked. They tend to have, the skin cells tend to stick together at the top instead of sloughing off. And so, there's a little oil gland connected to the pore. And so if the skin cells are sticking together, then the oil doesn't have anywhere to go to, it usually kind of flows out to moisturize your skin. But anyway, if it gets stuck there, it's going to get swollen. And if it's exposed to air, it oxidizes on top of those sticky cells, and it's going to be a blackhead. Or if there's some little film that doesn't expose it to air, it's going to be a whitehead. And then sometimes they, get infected, and then it becomes a pimple. Sometimes that happens because we try to work on it. So
it's hard to stay away from that.
Yeah. So, things to do to kind of work on that. Once again, basics. There is some suggestion that diet can make a difference. It's not like if you eat a pizza, you're going to get pizza face. But, good hydration, good sleep, anything that, decreases inflammation in your body can be helpful. So there is a study that links milk intake to acne. And so I always ask, especially my teenage guys, about milk intake, and sometimes they're drinking like a gallon every day, and just like the first thing I do is maybe suggest that they switch to organic, because we don't really know if it's the the sugar in the milk, because there's lactose is the sugar in milk. Some of us don't digest that well, and so you've probably heard of lactose intolerance, where you'll eat ice cream and then your tummy's pretty uncomfortable. But it could be, the sugar causing some inflammation, or it could be the hormones from, cows that are impacting our skin with, high milk intake. So I'll have them try organic first, and then see how they do for a few weeks. And then if they're still having issues, then I suggest they go dairy-free. We're lucky in this day and age that we have so many options with, non-dairy milks. Coconut milk tastes great. Oat milk tastes great. Almond, even cashew and macadamia milks are really tasty. I try to stay away from soy milk because soy is kind of a phytoestrogen, and we're worried about the effects of too much estrogen in our systems. So I tend to steer toward the other types of milks than soy. So And then, of course, skincare. Some people, I talked about kind of like the oil getting trapped.
Yeah.
I mean, some people, it's like they have acne, but they're also really dry. And
Sure.
so, they have, it's like we have to find a way to like, still have hydrated skin, but, minimize some of the comedogenic ingredients. So there are some oil-free products that can be really helpful. But it's like you don't need to scrub with a Brillo pad and, try to degrease your face every night, because that actually kind of is counterintuitive.
Sure.
So, we talk about products like salicylic acid, which is very anti-inflammatory. Aspirin is actually, kind of a salicylate, so there's some relationship there. And so salicylic acid, you've probably heard of retinols and retinoids. So retinol is kind of like a junior cousin of retinoids, like Retin-A.
Okay.
And then there's like the Mac Daddy, which is called Accutane, which is actually an oral form of vitamin A.
Okay. That's like the pill, right?
That's the pill.
I was on that, yeah.
Okay. Yep. And so, it's a medication you have to be super careful with, because it can cause birth defects. It can cause some mood changes and really dry skin. So, but if you need it, and you just have to be, carefully monitored, and it does work. Kind of that middle class, the topical retinoids, Retin-A, Differin, which is also called adapalene, and that's actually available over the counter now. So that's kind of cool.
I've seen that, yeah.
So, and it can be a little bit drying, both the Retin-A and the adapalene. There's a few other, related brands like Tazarac, etc. But we have people kind of try to ease into it. First of all, you don't need much. You just need a pea-size amount. And, I have people kind of spot the areas where the breakouts are heaviest, but you want to kind of spread the little spots out. But go first so you get the most product where the breakouts are the heaviest, but get some all over your whole face, because not only is it a treatment, but it's a prevention too. So,
sure.
Yeah. And how those work is that they do stimulate some collagen, and then they also make it so those cells, at the top of the pore that are supposed to just kind of slough off, they're getting sticky. So they help the cells not be so sticky, so that pore can kind of, just maintain its structure, and maintain the flow of sebum / oil out of the pore how it's supposed to be. And so that's how it works. But you got to be super patient. Usually when skin turns over, it takes 42 days. And so,
really,
a
That's a
6-week,
long time.
yeah.
Wow.
Usually when we write for medicines, we will say, let's, a good college try is 2 months. So before we make any major changes, but it can be super frustrating if you have a big event or something.
Yeah.
So
that was so much great detail. Like
Yeah.
I am pretty adamant on like researching this stuff, but the way you just explained that, I've never been explained it.
Oh, okay.
Like I feel like a lot of
makes
people are just like,
sense.
use this and it will help. But to actually hear what it's doing, that is really, really cool.
Yeah.
It's fun to talk to people, and I think it kind of, the knowledge kind of sticks better too. So
Absolutely.
So,
And so a couple of those products I have heard, going back to kind of the original part of my question, help with some anti-aging. I have been given tretinoin. I don't know exactly how to say it, but and a lot of people are like, this is the best anti-aging thing that you can get. So do people get prescribed some of those options for kind of age prevention?
Absolutely, yeah. And because a lot of people react kind of strongly to the tretinoin. I mean, that's, you're definitely going to get more bang for your buck, because it's, like 10 times as strong as a retinol.
But really?
But if it's too strong, start with, a retinol, and then kind of build yourself up. And once again, you can do the every other night, or even sometimes people will do it like twice a week, and then, and then there's other, it's like sometimes people have like a 3-product rotation of active ingredients. But yes, it definitely, golly, it was introduced like in the early 1970s.
Okay.
And I think it was Albert Kligman. What a name! But a guy from a dermatologist from Pennsylvania, I believe. And it was originally developed for acne, but it also has some potential, like treatment for pre-skin cancers and definitely anti-aging. But it does stimulate collagen, and so in some of my textbooks, I have some pictures of like people who went in for a facelift consult, and whether they were scared of surgery or they decided to wait a while, but the doctor said, hey, in the meantime, while you're deciding about surgery or what have you, use this and work up to nightly use. But the picture, it's it's like doesn't happen all the time, but sometimes people get home runs where it's like it's an incredible difference. Remember though, it's like it takes time.
Yeah.
The before and after pictures in that particular case that I'm speaking about, it's like 2 years, but it's like she looked 10 years younger in 2 years.
What specifically was she using in this?
She was using retin-A.
Okay.
Yeah.
I'm like, can I get this added to my cart tonight?
Yes, yeah. So, yeah.
Wow.
Yeah,
Well, I was telling Soraya, an esthetician, she gave me a retin-A, and I think I just used too much of it too often. So she told me to use it every night. And I don't think maybe it was good. I don't know, but my skin was burning last night after I washed it. So I'm like, okay, I think I'm just going to use moisturizer.
Yep.
And then it was still burning this morning. So I'm hoping that I just sparingly, when I use it, it'll be better.
Yeah. And,
but
once again, pea-size amount.
Yeah.
And just wait till your skin doesn't feel so reactive and then start again. But, maybe start, since you're a little bit more sensitive, maybe just do it like Monday, Thursday. Kind of like sometimes you'll have to like keep a little chart on your mirror. It's like, okay, it's Monday night.
Honestly, that's a great idea.
Yeah. So
you had mentioned like a 3 active ingredient rotation. I've never heard that. So what is, I know it's not necessarily for everybody, but what would that look like?
Yeah, you could use like a retin-A on one day and a vitamin C, and then maybe something with green tea, So but there's lots of different things you could do. There's so many great ingredients. It's like it's hard to keep up with all of them. Yeah,
it is hard, and it's overwhelming because you kind of want to do everything, but then that doesn't always work so well.
Right.
Yeah.
And there's so many products on the market and so many things that you're told this will work great, and that But kind of steering more into, like, let's say the injectable side. What are certain injections that you use to treat certain things, whether it be anti-aging or acne, I guess, whatever those may be?
Yeah, great questions. So, I'll segue, with injections kind of going, with acne, because a lot of people don't know this, but we can do emergencies at treatment. So it's like, hey, it's like I have an interview tomorrow and I feel like Rudolph, or or a bride with, it's like nobody's gonna notice, but she's gonna notice. So it's gonna, stress her out. So we use really tiny needles and a very teeny tiny amount of a steroid, and there is a tiny risk that you could get like a little chickenpox scar, but it's very rare.
Okay.
But but the tissue can involute, but most of the time it just takes down the inflammation of the pimple, and it gets it to kind of sink back into like the normal plane. So at least it's still probably going to be a little bit red, but it'll be much easier to cover up than a big pimple.
Wow.
So cool. Can I make an appointment
before
a trip, because we're going to New York on Friday and I gotta get rid of these.
You literally can't even see anything.
I can't see a thing. You look amazing, but
that's really cool.
Is that a new product, or have you done
No,
that?
it's been forever, but I think just a lot of people don't know that whenever possible we'll try to work you in if you need like a little pimple emergency treatment. So
totally.
Wow.
Yeah, so
that's really cool.
Yeah. So, and then you know, a lot of people don't know the difference between neurotoxins and fillers. And so, yes, they're all delivered with a needle, and sometimes we deliver fillers with a cannula too, and I'll explain that a bit. But you know, it's kind of apples and oranges. So, you know, Botox isn't going to make your lips plump. You know, Botox should make your lips like this.
So we don't want that.
Yeah. So, but anyway, Botox kind of, you know, modulates the, you know, those expression lines. So, so, you know, we use it, you know, the most famous use is for the 11s between your eyes. Sometimes people have a 1, sometimes they have 11, sometimes they have 111, you know, and, but it relaxes there's two little muscles on either side called the corrugators. They push in and down. And then there's the procerus, which kind of squinches things up there. And so that was kind of the first area that we really focused on. And then, of course, crow's feet too. And doing a little bit of crow's feet can actually raise your brows. So, yeah, so, you know, kind of like you can almost like sculpt the expressions a little bit. And
wow.
Yeah, so, but if we want our brows to go up, we got to kind of take it a little bit easy on the forehead, because we still need that you know, the tone of the forehead muscle called the frontalis to kind of help lift our brows. So there's a real artistic way to do that. So yeah,
that is crazy.
Yeah.
yeah.
I just didn't really think much behind that, you know, as far as, like you said, the sculpting and
yeah. So
very interesting.
So what about Botox on your smile lines? Is that something that people, because it runs in my family, have really deep smile lines, which is fine, but sometimes I'm like, ugh, like I wish
you
they
mean
weren't
right through here,
yes,
the little parentheses.
So is Botox make sense there, or
not really?
Okay.
And first of all, you know, it's like we're all so critical of ourselves. You are just so cute. And so, and you know, basically, you know, your smile, you know, there's a little muscle called the rosaris muscle, and it attaches right here. And then when you smile, it's like a little accordion, and it pulls things back.
Sure.
And while you're so young, you don't get like the little, you know, extra accordion lines. So, but you do have that insertion point. And so, you know, there's ways to fix that, but it's not with Botox.
Okay.
Now, there are a few like things that are around there, like there's a little muscle that pulls your lip kind of down, and so it's a muscle that kind of goes from here to here. And so if we put a little bit on either side, we want to stay far enough away so we don't cause a little asymmetric smile, but we can put a little bit in through there, and it actually can lift the mouth corners up. So
cool.
Yeah,
really
so,
cool.
Yeah.
Oh my gosh.
So
that is wild.
But for deeper smile lines, first of all, you know, we want to make sure that the smile lines aren't from sagging cheeks, which is not your issue. You just have a deep insertion, genetic. And so you can soften that though by laying a little filler in there. It's not going to go away though, but it's just going to make it so it's not like a sharper crease. But once again, you know, those are lines that don't really, they convey your smile. And so other people, it's, you know, it's like, it doesn't bother other people, but if you want it to be a little less sharp, you know, you could certainly do something. But
interesting.
Yeah.
It makes you.
No, I'm not going anywhere with that. But
teasing.
I'm always curious, and something Paige and I we've talked about this a lot, because we just love this stuff, even if we don't necessarily do it all. It's just so fun to learn about.
Yeah.
And filler, I think, is something that, especially we're in our 20s, we're seeing a lot of people becoming more comfortable with getting filler at kind of that younger age. And I don't know if we read this somewhere or if we just like think this, but we're like, doesn't it stretch out your skin? Like, is this something that you know, 20 younger something should be doing, or is it something that you should be putting off until kind of those later years?
For example, if you get your lips filled now, are you going to have to continue to get them filled? That's just an easy
Or
example.
are you going to have any like you know,
saggy?
Yeah. Great questions. And you know, I don't think that there's any major untoward effects, although, you know, because a lot of us are so social media conscious, and, you know, the Kardashians and you know, they're all, you know, it's like God bless them. They're incredible businesswomen. You know, there's a lot of really cool things about them. And so, but, you know, it's like they go for really exaggerated features, like, you know, the lips, etc. It's like super interesting to watch, you know, especially Kylie and Kendall with the transformation. And it's like my aesthetic preference is not to have, you know, lips that are like 3 times the size of normal.
Yeah.
And, you know, but we're so used to seeing it that sometimes people request that. But you know, it's like I try to like reel them in a little bit. And so, you know, you can add a little extra volume and, you know, full lips, you know, you know, it's like, you know, sometimes like there's a little like, you know, hard wiring. It's like full lips convey like fertility, et cetera, et cetera.
Sure.
And they're very attractive, but you know, it also has to match your face. So, you know, you guys are both, you know, super petite and you have beautiful natural shape of your lips. And yeah, like, you know, some enhancement would look fine, but, you know, a significant amount is going to make you still be beautiful, but it would be, you know, it's like, you know, where's that line between like, you know, I think in our area we kind of go for more of the natural beauty look.
Definitely.
And whereas, you know, out in California, it's maybe a little bit more of the, you know, the Hollywood beauty look. And so, but it's, you know, I think if you do it, you know, and then, you know, that, you know, you're, you know, maybe adding like 1 ml to your lips, you're not going to cause any damage.
Sure.
And filler does, you know, it resorbs. You know, it's made, most of them are made of hyaluronic acid, which is a natural sugar that's already found in your skin. And, you know, over time it resorbs. It does tend to make your lips look a little more dewy because it draws a little water in. And so, you know, like you tend to not have as many like, you know, your lips look really well hydrated.
Sure.
I can almost always tell when people have had filler in their lips.
Really?
Because, well, mostly because they kind of look just a little more juicy. And, you know, it's like, you know, you can go a little bit too far with that
Totally,
too. But,
yeah.
But yeah, it's, you know, even the people who have really big lips, it's gonna resorb, and you'll go back to pretty much your, you know, your normal self. I have seen a few people who end up with like almost like a little bit of scar tissue in their lips, though, after they've, you know, they're kind of more firm.
Sure.
And studies have shown that, well, you know, most of it resolves, you know, it's like sometimes, you know, if you took like a biopsy, you could still find little granules of the filler, you know, in the tissues. So, but you know, it's like, you know, I think you'd have to do an awful lot. Usually it just kind of resorbs slowly so that, you don't like deflate. It just, it's a real gradual process. And so your tissues kind of reaccommodate. And so,
interesting.
Yeah, but,
That makes more sense.
It does.
We were like,
We're probably on to the extreme, like, don't do it, you're gonna be saggy, but no, I'm just kidding. That's really interesting.
You're gonna need a bra for your lips.
Yeah, exactly.
So before we started recording, you mentioned something about micro Botox. Is that what you said?
Yeah.
So what is that? I've never heard of it. I'm so interested.
Yeah. So, first of all, like I had some in my forehead, and you know, I'm kind of, you know, it's like I hardly ever have time. But one of my nurses, it's like she said, "Oh, you know, I have 15 minutes in between this patient and my next patient. Come on." And so anyway, and I don't like, you know, I have, you know, a little bit of texture in my forehead that I don't love, but I'd still like to move my brows, and because too much, I don't like that heavy feeling. So, so she just did tiny, like, you know, really tiny, like half unit doses, kind of sprinkled. So I'll still, you know, it'll help with the texture of the skin, and it'll help a little bit with the expression lines, but not take them away. We also did that a little bit underneath my eyes. And so, you know, the skin and the muscles super thin there. So just like, you know, maybe 5 units altogether, but, you know, put in little tiny, like half unit aliquot. So it,
wow.
So
I
anyway,
didn't know
so
that you could actually do it under the eye. I've heard
Yep.
because it's so thin and
Yep.
sensitive. I did not know that.
Yep.
And I feel like that under eye area for me, and just for anyone I know who kind of struggles with it, that is just one part. It's a hard part to target.
It is.
It is.
Yeah.
I think I struggle with circles, and that's something I'm always trying to figure out. And I just think that's who I am. But it's so interesting.
Yeah.
What do you do for, what are other under eye, you know, treatments that you see done a lot?
Yeah, the great question. You know, first of all, we're so lucky. It's like sometimes I just drool over makeup videos. I'm like, whoa.
I know. Bless the
incredible.
concealer.
Yeah, bless. Yeah. So you know, it's like, you know, there's a lot of sins that can be just, you know, with a little concealer. It's like pretty amazing. But you know, I think people get a little confused about you know, the under eye. It's first of all, you know, you've got the muscle layer, and so, you know, when you smile, you're going to see like a little roll underneath the eye. And that's just your orbicularis muscle kind of, you know, rolling up. So smile for me. So you can kind of see just this little top part. And then we have a little valley, and then we have our cheeks. And so some people, you know, that you know, there's not a real definite little valley there, but most of us do have that where you'll be able to see the muscle, and then a little tiny valley, and then the cheeks. And then as we get older, you know, that the cheek kind of slides down a little bit, you know, the skin gets more thin. Sometimes the muscle kind of, you know, relaxes, and it allows the fat pad to protrude. And so sometimes in really older people, you can kind of see almost like a fatty bag there. And so and those are, you know, you know, you almost need like lower eyelid surgery, and it's not a perfect solution, but you can either go underneath the eyelid and operate from behind, or else right underneath the lash line and kind of pull back the muscle and take out some of that extra fat.
Wow.
That is wild.
Yeah. So, and then
have you done that?
yes.
Oh my gosh.
Wow.
That has
How long
got to be
does that-
crazy
How
to
long
do.
is that surgery? How long does that take?
It takes about an hour to an hour and a half.
Holy
so.
crap. I can't even imagine like peeling back someone's eye. I mean, that's
I can't
crazy.
believe we're sitting next to you right now. I'm sorry. That is so cool.
That is really
That
cool.
is so cool.
Thank you. I think a
Yeah.
lot of the stuff you do is cool too.
Oh my god.
Yeah. So, but
Okay, keep going. We interrupted you.
Okay, fine. That's fine.
Well, and not to interrupt more, but I'm so curious on what has been like one of your favorite success stories.
Yeah.
for
That's a great
client.
question.
Yeah.
Yeah. Golly, you know, a lot of things. I guess, you know, one of my, you know, very early on, even before I opened my own practice, I had a little baby with a very large hemangioma on her lip. You know, it was probably the size of a walnut, so a big red, you know, a red tumor on her lip. And you know, I was able to like take that out surgically, and she's probably like 20 years old now, and I still see her mom every once in a while, and they're so grateful, and her lip looked completely normal, so she didn't have to grow up with you know, that going on. And now it's like, you know, I love how medicine progresses, because you know, maybe 10 years ago someone discovered that a medication, a heart medication called propranolol, it's a beta blocker. If babies have hemangiomas, you know, sometimes they can be, you know, just like a, you know, a cosmetic birthmark or a bump, or sometimes they can, you know, they can be so big that they, you know, affect vision, or so they can be really problematic, and so but they discovered the propranolol could really, you know, settle down the growth phase of those. And so you know, like, you know, I probably wouldn't have to do surgery on a little child. First of all, it would never probably get that big, because that child would be able to be treated with propranolol. So yeah, so but that was kind of cool. And you know, I love eyelid surgery. You know, tends to be more upper eyelid surgery than lower eyelid surgery, and mostly because, you know, it's like insurance doesn't cover this, and so, you know, some of the elderly people, they'll kind of put up with those bags. But you know, if they've got, you know, hanging skin, it's really hard to see.
Yeah.
And so you know, I love, you know, upper eyelid surgery is very you know, it doesn't hurt very much. You know, it's kind of some wild and crazy bruising for about a week. I once had a older man who said, "Oh, I should have done this closer to Halloween."
Didn't need a costume.
Yeah. So, but yeah, it's like you know, it's a great example of kind of like, you know, functional improvement and better aesthetics. You know, you can see people's, you know, their eye color and they just look so much, you know, more awake and happy. Another older gentleman was a widower from Castleton, and he had his 2 daughters both lived in Minneapolis, and he would go to visit them once a month. And so he would drive, and he would always stop at the, you know, I can't remember exactly where it is, past Alexandria, but there's a rest stop.
Okay.
And so he would stop there and he would take a power nap, you know, 20-30 minutes, and then he would drive the rest of the way. Well, after his eyelid surgery, he didn't have to take any power naps.
Because you're kidding.
Yeah, because he just you know, I mean, he exerted so much effort at keeping his eyes open that when he didn't have to do that, you know, he had more energy. So that was kind of cool too.
Cool.
Yeah.
Oh.
So
It really is so all-encompassing. I mean, the smallest things do affect really everything.
Yeah,
and that
totally.
is so incredible that you get to be a part in improving people's lives in that sense.
yeah, it's, you know, it's as I said, it's kind of an honor, and so you know, it's very hard work. You know,
Yeah.
you know, when I talk to you know, women in going into medicine, or even like talking, I always welcome like people to come shadow. Like if I have high school students or college students, or you know, nursing students or pre-med students, or whoever wants to come, you know, I tell them that I have to go kind of fast, and that sometimes, you know, I might not have time to explain everything to them, but at least they can kind of like watch what happens in clinic, because there's such wide variety. But too, you know, it's like there's a lot of sacrifices, you know, and I think we're recognizing this more. But you know, it's like you know, a lot of sleepless nights, a lot of stress, kind of just getting into medical school, then at medical school, and then residency. You know, you know, even though you know, it's like I never had controlled work hours. I you know, you know, there were lots of weeks that were over 100 hours, but and you do kind of get delirious from sleep. But it's also like, you know, it's hard to, you know, I was never, you know, the greatest, like, you know, with, you know, having dates and all this, you know, and so kind of shy. And so anyway, you know, it's like, you know, I was 34 when I finished my residency in Seattle, and you know, I'd had a few boyfriends during residency, but none that stuck. And so I moved back here, and you know, so I didn't get married till I was 40, and you know, by then, you know, it's you know, fertility is an issue, and so I had a couple miscarriages, and then we kind of had this miracle happen with you know, one of my referring doctors from Jamestown, Dr. Tanya Hogarth, who still practices in Bismarck and Minot, and she's a great lady. But she said, want to have a baby? I still have the little note, you know, she called my office, call Dr. Hogarth about a baby. And so anyway, she said, you know, I met a birth mom, and she's 36 weeks. She kind of was in denial, so she didn't really have any prenatal care, but she seems like, you know, everything is going fine, and she's interested in an adoption plan. And so I heard that you were having a little trouble having a child, and you were, you know, maybe thinking about adoption. And she'd heard this from one of the patients that I had taken care of hers. So anyway, so yeah, that's how I have my son. So
Wow.
he was born a month later. But,
That makes me want to cry.
it
That
makes
is
me
such
tear
an
up.
incredible
That's
story.
incredible.
yeah. So, and his name is Grant, because he's my wish granted. So
Okay.
Yeah.
That makes me want to cry.
Literally, I'm going to start bawling
That's
right over
amazing.
here.
Everything truly works out the way it's supposed
yeah,
to.
yeah. But you know, it's like, you know, even younger women, you know, y'all's age. We don't know why, but a lot of people are struggling with infertility. Is it something in our environment? It's like we worry, sperm counts are going down. Is it because of plastic? Is it because of, it's like, it's like everything works together, and it's like, you have to ask why. But for some people it's I'm Catholic, but I also believe that God wants us to, he wants us to be happy, and if that involves children. So, it's like, there's options to freeze your eggs. And, if you haven't found Mr. Right, and hopefully you'll find him at some point or not, but, there's more options to be a parent. And two, if it, if some people are, childless by choice, and, and others by circumstance. I had already planned European vacations for all my nieces and nephews. So, that might, that got put on hold a little bit, but, I just, there's lots of ways to mother, I was, even in my office, I'm kind of like, it's like, I'm kind of your den mother, you guys. And, it's like, it's like the practice is my baby. In fact, we were building the new building right at the same time that Grant came along. So it was like, I had two babies, like a 9-pound baby and then a 14,000 square foot baby. So
best of both.
Yeah.
Yes.
So,
and you guys offer some women's health specific services.
Yeah.
And we didn't really get a dive into this looking at your website. But I think this would be a perfect time to talk about that, given we're talking about fertility and different things around that nature. So what does that include?
Yeah, well, we, it's like, first of all, kind of approaching things from a functional medicine perspective. And, we have this fabulous nurse practitioner named Lana Meyer, who, it's kind of her passion, because sometimes like hormone replacement is a good idea. Sometimes it's not, but knowing where you're at. I mean, I think that's, knowing your numbers, whether it's for cardiac health or for, fertility health, or just, where are you in the, the journey of menopause, those are all numbers that can be helpful to understand how you're feeling and optimize how you're feeling. So I think we all want to, as I said, live our best lives, whether, and some of that, includes, looking our best, but it also includes feeling our best. And those are really intertwined. And so, yeah, it's fun that, she gets way booked out, but she's so awesome. And we also have some like some kind of innovative treatments. You may have heard of the M-Sculpt, which is kind of a body contouring system, but that actually can really help your core. You can do, belly and butt, and it can really strengthen your core, help with back pain. And then we also have, created by the same company, similar technology, but it's for your pelvic floor. So, you kind of sit on it, and it's, we call it the orgasm chair. but it's like, you kind of adjust yourself so you get those contractions of your perineum. And so it can help for incontinence, it can help for sexual health, but, we kind of talk about that core to floor, and, how kind of feeling rooted in your body, it's like, it does give you that confidence and power, and helps you feel like a queen. So
love to hear it.
Love to
hear. Gosh, these are things I've never even known about.
Well, it's lots of cool stuff. As I said, super passionate about, helping people in so many ways, and it's been fun to develop a team. Obviously I can't do it all, and so some additional providers in dermatology and on the cosmetic side, and then Lana and Lana Meyer on the medical side with women's health, and we also have Taylor Fontaine, who is our only brave guy. And he is a rock star.
Heck yeah. Somebody's got to do it.
Yeah. He used to be, he used to play golf for NDSU, and
cool.
he still has a really good golf game. And he used to be an emergency medical technician, so he's kind of got that, he knows how to get things done, and is just super kind and a great guy. So
Wow.
yeah. So we have a lot of fun at our office.
That is so awesome.
But you have a pretty big team, right? As far
We've
as
got about
everybody?
30.
Oh, cool.
Yeah,
That's
so-
really awesome.
Yeah.
So when you first started, then was it just you, or?
I had one nurse, one kind of business person, and one esthetician. So yep.
Wow.
Yeah.
And now look at it.
Look at it now.
Look at it evolve.
So it's been fun.
Yeah. Well, we put together a really fun game. I don't
Yeah.
know if you were going there,
Ooh.
but that's where I was going.
Yeah, we're probably going to have to cut it short because honestly, time has just flown.
Time is flown, and
so
we don't want to take up your whole night.
Yeah.
But this is fun. So this is like a rapid fire favorite.
Oh, okay.
So we'll kind of just name bullet points, and then you tell us your favorite.
Okay.
So sunscreen.
Ooh, I really like Revision, the tinted moisturizer,
Oh.
SPF of, I think it's 50.
Okay.
Okay.
Revision.
Revision.
Perfect.
Yep.
Under eye cream.
Oh, yeah. So I just used my Skin Medica under eye cream. So yep.
Okay.
So
Okay.
yep.
Cool.
Yeah.
What about under eye patches?
I have not used those.
Okay.
But I way back when there were these jelly ones that I got at one of my aesthetic shows, and I think they were called Doo-Wop or something. They were kind of fun, and they were cooling, and they felt good. But
Yeah.
I don't do them regularly.
Sure.
so-
Okay.
What about face cleanser?
Oh, great. I really like the IS Clinical Cream Cleanser. So it's something you can actually, they give it to the service women who served overseas, because it's like you don't have to use water. So
Wow.
it's like a cream cleanser, and then you can wipe it off. And so
Oh my gosh.
I usually use water, but it's kind of, has kind of a neat purpose. And so you feel clean, but also moisturized. So
Cool.
So speaking of moisturize, what about your favorite face moisturizer?
I love the TNS essential serum. So
Okay.
it's got serum and moisturizer mixed together, and so
Oh.
it's kind of like, I'm kind of basic with my
Yeah.
stuff. It's like, okay, so it's like, if I get that on and some sunscreen, I'm feeling like I'm pretty good.
Yeah. Amazing.
So a 2-for-1, and then
Yeah.
Yep,
that's
yep.
awesome.
What about a skin brightener?
Oh, there are so many. I think, any kind of vitamin C product is going to give you some brightening. And then I also love like the photofacial. It's intense pulse light. Some people call it like a BBL.
Okay.
But basically it's like a broadband laser. It targets multiple different wavelengths. When when you're in school and they taught you about Roy G. Beebe, well, those different colors actually are like, if you have like a laser is just like one color and it has
Sure.
a certain target. Well, this has that whole spectrum of different light. So it can target red really well, and it can target brown really well. And so it's good for vessels like rosacea, and it's also good for sun damage, and it stimulates collagen. So I think that's like the ultimate,
Cool.
So do a
That
series of
sounds
those.
amazing.
So,
Yeah, well, that's awesome. You might have a couple for this, I'm not sure, but what about your must-have when traveling?
Oh, okay. Yeah, it's pretty much, here's one thing. I try to have like a double, because if I don't, I always forget stuff. So I have kind of like pre-packed bag that has like, my usuals, like a little bit of the cream cleanser, my TNS, essential, the new one that doesn't stink. The old one was kind of smelly, but yeah, they reformulated it, and so it's more cosmetically elegant. I think that's it. A pre-packed bag of just like the same stuff that I use at home, and I have like, my favorite hairbrush, my favorite comb already in there. I have my swimsuit in my suitcase. I just keep everything in there and then just replace as necessary.
That's
So,
smart.
What a great hack.
I never even thought of that.
All right, ways to depuff.
Oh, okay. You can kind of do, just like cool compresses, and cucumber slices do work. Tea bags do work a little bit. I wouldn't do this on a regular basis, but in an emergency, a tiny bit of hydrocortisone cream. But once again, you don't. If you use them regularly, it thins your skin. But like if you I have a little bit of puffiness from my micro Botox. Probably if I put just a tiny dab of the hydrocortisone cream, it would help shrink it up a little bit. And but I would very rarely do that.
Sure.
And but cool. And then also elevating. It's like your eyes are always more puffy in the morning, and so it's like you can sleep with your head propped up if you've like got to be completely depuffed in the morning. But
oh my gosh,
yeah, because gravity affects
Totally
us.
could, yeah.
So
standing, no.
a couple a couple pillows if but most of the time it's like once you get up it tends to drain away. But cool compresses are probably my favorite thing. There's a couple, I can't remember what it is, but there's a couple eye creams that have like a little silver tip and like a little bit of the product comes out, and then they're really and it's like you kind of roll them under. That kind of has the beauty of the cool metal tip.
Yep.
And then you put the product on. I just can't remember what it is. But,
Well, I've seen it at Ulta. It's Tula, the Tula
Okay.
brand.
Tula
I don't know if that's
does
what you're
one.
thinking of, but I'm sure there's other ones.
There's a
too.
lot,
Yeah.
I think. Yeah. Interesting.
Yeah.
Cool.
Yeah.
What about
Pretty fun.
for evening skin tone? Like to even out your skin tone?
Yeah, I think, all of the products, it's like, your retinol is going to kind of, even things out. I have some sunspots, but I don't really have melasma or anything like that. It's like, a little bit of tinted moisturizer, kind of, for me, that's with a little bit of SPF, that's kind of my thing for making everything kind of blend together. So,
Yeah.
Couple more.
Okay.
Everyday serum.
Ooh, see, you guys are, it's like, I just can't, I can't do the 6 product regimen. So,
And if there's not, one, doesn't have to
kind
be
of,
one.
yeah. So kind of like the, the TNS kind of has the serum and the moisturizer. So that's my, it's
2 for 1.
2 for 1.
Yep, exactly. So that's kind of what I use. So yeah.
Okay.
Yeah.
Cool.
Yeah.
At-home face mask. I don't know if there's any favorites that you have.
I'm kind of a junkie for I've kind of graduated from Birchbox because I like some of the bigger sizes, but I get Ipsy, I get there's one called Skin Ox that's all like organic products.
Cool.
So it's like I get so many like random it's like I have this little stack of like skin masks, but I can't remember the names.
Yeah.
of them.
Yeah, that's really cool.
But and sometimes my son is 14 now, but in the past we've done masks at home and
Fun.
That's so
the
fun.
peel off ones that are just so fun. And there's one oh gosh, what it is, it's gold, so it's like you feel like it's like you're encased in gold. You look like you're the Oscar, statuette. So anyway, but yeah, we've done a couple of the gold ones. I just can't remember the names. Sorry.
No, that's cool.
All right, last one, and I'm so interested to hear what your thoughts are on this. But a beauty tool.
Ooh, yeah. Oh, so many. I'm gonna say, I still use my Clarisonic brush, which they don't make them anymore, but it's still awesome. I bought a few extra little heads for it. But there's something that I haven't gotten yet, but this is like my next purchase, and it's going to be a face mask that does red and infrared light. So
okay.
yeah. So
I've seen
yeah.
I have seen those, and I really want one.
I do too.
Yeah.
Okay,
So-
now you've convinced me. I'm like, if you want it, I want it.
Yeah. Yep. So yeah, I'm super excited about that. So that's gonna be my
Well, tell us
Christmas
how you
present.
love it. There you
Yeah,
go.
Yeah.
to myself.
There you
So,
go.
Yeah.
Well, this has been so much fun.
So fun.
you so
I
much.
truly
We've
felt
learned
like
so much.
time just flew by because
Yeah, me too.
everything you have just so much knowledge. That was so incredible.
Oh, thank you.
Yeah.
I had so much fun talking to you guys too. So you're rock stars. Thanks for doing this. It's a lot of work. Here you are on an evening and taking your time to like help share information with your audience. So I'm honored to be here. So thank you.
Absolutely. So much fun. So where can people find you? How can they connect with you?
Yeah, well, we're the building off the interstate. We have a butterfly. Probably this spring, when I save up a little more money, I'm going to get the sign changed out and put a little digital on there too. But Catalyst Medical Center, we're right off the frontage road of Interstate I-94. We're in between 25th Street, which is where Doolittle's is, and then University. There is a little bit of road construction, so sometimes it works better to come in one side or the other, but it's 1800 21st Avenue South. Of course, we have our website, catalystmedicalcenter.com, and you can always call us to 701-365-8700.
Nice.
Perfect. Well, we'll link all that so it makes
Thank
it
you.
easy for people to
you.
see and find you. And
Yeah.
Thank you.
Thank you so much. Cheers. Thank you to Dr. Sue. We so appreciate it.
Oh, this was a blast. Thank you.